Okay. Okay. There we
Sorry
go.
about that. Thank you. Bye-bye.
All right. So, it's no wonder why most Americans believe that we're not getting good value for what we spend on healthcare. Now, I just want to give you a little bit of perspective on what the healthcare systems are, because you'll hear politicians throw out various terms, and to show you that we have sort of elements of everything in the United States. So when you hear people demonize Medicare for all or call it socialized medicine, we actually have parts of our healthcare system that are socialized. First of all, socialized medicine is when the government owns and operates every aspect of the healthcare system. They own the hospitals, they employ all the doctors, the nurses, the radiology equipment, the laboratories, every aspect of that. And we have countries like that, like Great Britain has the National Health Service, Denmark, Sweden, but we actually have that in the United States. Our VA system is a socialized healthcare system. So isn't it ironic that the people that fight for our freedoms are covered by a socialized medicine system? The next system that most of you have been covered under at some point in your lives is the employer-sponsored system. So in in Germany, there's a mandate that every employer, you have to get your coverage through your employer or some government-run program, but the majority of people do get coverage through their employer. And that's where I would say the majority of Americans in the United States get their coverage, either through their work or through their spouse's work or their parents' work. And then you have systems where you have a single payer. And what that means is the government doesn't control the healthcare system. It just merely serves as the insurance company for everybody. So instead of having Blue Cross Blue Shield, Medicare, Medi-Cal, all of these various insurances, you just have one government-run entity. And we have that in Canada, we have that in Taiwan, and we have that in Korea. And then certainly we have our uninsured system, which is like Myanmar and Burundi. And we have about 33 million Americans that are covered under that system or are not covered under that system. So these are the various types of healthcare systems that you'll hear people use. But unfortunately, the United States has all of these. And that's part of the reason why our system is so convoluted and complicated. So in the run-up to the Affordable Care Act, I was a regular contributor on Larry King Live, and I would debate Ron Paul. Ron Paul is a libertarian, and he would always say, we don't need more government, we need less government. He said a government plan would be a job killer, and what we really need is more freedom, right? You hear this continual point about freedom, freedom, freedom. But let's talk about freedom. First of all, the Heritage Foundation, which is a very conservative think tank, comes out with a ranking of the best economically free countries in terms of regulation, things of that nature. And if you look at all of the countries listed ahead of the United States on this survey, what do they all have? They have a government-run healthcare system. So somehow the idea that a government-run healthcare system would take away economic freedom is not true. And then down below, if you look, Ron Paul said that the Affordable Care Act would be a job killer, but look at what happened to job creation from the time of its implementation up until COVID, right? Job creation went through the roof. So you hear all these lies perpetrated by the right, but they're not rooted in fact. And let's talk about freedom as a whole. So many of you who have insurance the insurance company constantly dictates what doctor you can see, right? You get this book of doctors in their network. And if you go outside of that, you can't, you have to pay more or they won't cover it. And the reality is most of us are in networks that are narrow. And what that means is that of all the doctors in a certain area in your neighborhood, you're only allowed to see 25% or less of all those doctors. So when you hear politicians say that a government-run plan would take away your doctor, the insurance industry is already doing that right now. Medicare does not tell you what doctors you can go to. Insurance companies will also tell you what doctors can order as far as tests, what prescription drugs they can prescribe for you, what hospitals they can admit you to, what other doctors they can refer you to. So the idea that there's this freedom existing in our current healthcare system is not rooted in fact. The government never tells doctors what to do, but the insurance industry is constantly getting between you and your doctors. And also, if you have your job through your employer, maybe you hate your job, but the reason you don't want to go look for another job is because you can't afford to leave the health insurance that you're getting through your job. So there's a lot of people that are stuck in jobs they hate strictly because of their healthcare benefits. So by every metric, there is no freedom associated on an individual level with our healthcare system. And then if you look at from a physician standpoint, just in the last 6 years in California, or 9 years, there have been over 45 million denials, meaning that every time I've gone to prescribe a certain drug, or if I wanted to refer you to a doctor down the street that I know and trust, insurance companies sometimes will come back and say, nope, we're not going to prescribe that medication. You have to give this cheaper one. You can't prescribe to this doctor. You can only prescribe to this doctor that we're contracted with us because he charges us far less. So they're constantly getting between me and patients as well. So let's talk about the Affordable Care Act. In the run-up to the Affordable Care Act, there were 3,300 registered healthcare lobbyists for the 535 members of Congress. So there were roughly 6 lobbyists for 1 member of Congress, and they were spending more than $1 million a day. And in total, more was spent lobbying Congress than was spent on the Bush-Kerry election. And it's no wonder we had no insurance rate regulation or drug pricing control with the Affordable Care Act. And let me show you what that means. So, those of you that are still getting your coverage through your employer, chances are that over the last 10 years, your wages have remained stagnant, which is down below the workers' earnings, right? Meanwhile, inflation has remained pretty stable, although, right now inflation is up, but up until this last COVID year, inflation was pretty tame. But the amount of money that has been deducted from your paycheck each month towards your healthcare, even though this is your employer giving you health coverage, has gone up dramatically over the last 10 years on the front end. And on the back end, if you get sick, the amount of money that you've had to pay in copays, deductibles towards your prescription drugs has also gone up. So it's a combination of 3 things. Your wages remain stable, but they've taken more out of your paycheck each month towards your healthcare premiums. And then once you got sick, they've taken more money out of the back end. So it's no wonder the average American has less take-home pay each month. And then if you look at the number of Americans who report that it's harder for them to pay for their premiums each month, pay for their copays or pay for their deductibles, it's also gone up each year. Sorry. And then let's talk about prescription drugs. Remember, I said there are 2 things that the Affordable Care Act failed to do, which was regulate insurance rate premiums. But the second thing was prescription drug costs. So in 2017, it was estimated that 45 million Americans did not fill a prescription because they couldn't afford it, meaning even though you had insurance, they couldn't afford the copay or deductible. And that 1 out of 5 seniors does not fill a prescription because of cost. And yet Medicare has still been prohibited from negotiating drug prices. So when United Healthcare or Kaiser uses its market share to negotiate steep discounts in drugs, it's considered good free market, good business sense. But when Medicare tries to do it, it's considered government interference. And this is the hypocrisy that ultimately affects our seniors. And then the other thing, this is just to show that you can have insurance. Like if you have an insurance card, but your copay or deductible is so high. So example is that some of these bronze plans that you can purchase under the exchange, they have a $6,800 deductible. What that means is starting January 1st, if you felt a lump in your neck and you have to go to get a biopsy or get a test, the first $6,800 of all medical expenses has to be paid for by you before your insurance kicks in. And at that point, the insurance would cover 60%. Well, most people don't have $6,800 laying around. And the problem is, as a result, even though, quote, you're insured, it's not worth the paper that it's printed on, because here it just shows you 1 out of 3 people that has insurance will delay seeking care because they can't afford their copays and deductibles. And yet you have politician after politician that says, oh, we just need to give everyone private insurance, rather than taking away the copays and deductibles like people like Bernie and Pramila want to do. So I just want to give you a few more slides about how COVID really exposed everything that's wrong with our healthcare system. We're now upwards of 750,000 people that have passed away from COVID. And I think the sad part for me is I think we as a society have kind of become numb to that because of the deaths. I mean, when you look at the sheer number of people that died in 9/11, which was tragic, this is really, dramatically multiple logs more. And yet we've just brushed it off as this. And particularly when you look at the number of deaths in the senior community, it's been tragic. I know quite a few friends of mine who've lost grandparents or parents due to COVID. And I would say that for any of you that have lost a loved one, my condolences, and may we always honor their memory. But this is something that is still going on. And let me show you what it exposed. So remember during the Democratic primary when Joe Biden slammed Bernie saying, the countries that had single payer, their death rates were so bad. And if you look all the way to the left of this curve, yeah, there was a time where Italy was struggling with COVID deaths. But now look at how the death rate has been in the United States compared to those countries that have a universal healthcare system. So that was one of the lies that was perpetuated by Democrats, that a Medicare for all plan would do that. And then this was a study that came out last September. The Lancet had a special commission that presented at the 75th session of the UN General Assembly. And it said that roughly 40% of all the deaths in the United States that were coronavirus related could have been prevented because the majority of them were simply caused by a lack of insurance. How does that make us look as a country? And then let's look at, you had Amy Klobuchar during the debate say that, Bernie, you want to kick all these people off their employer-sponsored healthcare. Well, look at the number of millions of Americans that lost their employer-sponsored healthcare because they lost their jobs during COVID. But you want to see how many people lost their jobs in these countries, their job-related healthcare? None. And I think we finally realized that healthcare should be a human right and not a job perk, right? So the big question is, why are we spending so much and getting so little? So this is a very convoluted slide, and it's meant to be, but just to point out, let's just say one of you is working right now and you get your coverage through United Healthcare. Next year, you switch jobs, and now you get coverage through Aetna. Maybe you lose your job and now you're on Medi-Cal, then you turn 65 and then you go on Medicare, and you try to go back to your same doctor or you go to your hospital, and they've got to figure out, first of all, what insurance do you have now? Am I even in your network? Can I even see you anymore? What's your copay? What's your deductible? And all of that administrative waste trying to figure that out. And then if they are allowed to see you, then send the bill in to this person. It takes time and money away from actual patient care. It takes time and money away from actually spending time with you, right? And not to mention how much time you have to spend on the phone fighting with insurance companies to get things covered. But this is our convoluted, very multi-tiered, complicated healthcare system. And it's estimated, if you look down below, well, first of all, on the down below, above, the green line is the number of physicians that have been trained in the United States from 1970 to 2015. And then if you look up above, it's the number of healthcare administrators and managers. Many of them have been hired strictly to deny care and maximize profits. And down below, you'll see that the US health expenditures look from 1960 to 1980, they remained relatively flat. But then at the same time that you saw this huge rise in healthcare administrators and managers, look at what happened to healthcare costs. Do you think there's some coincidence that the reason these healthcare costs have gone up mirror the number of people that are designed to muck up our system? In fact, Duke University has more billing clerks to handle claims than it does hospital beds. Imagine if a hospital could use more of that money to be prepared for the next pandemic. You know, a lot of the hospitals here in Los Angeles, particularly those that were in the inner cities, couldn't keep enough generators or ventilators or all the necessary equipment because they had to spend more money hiring people to fight with insurance companies to get paid. And just makes you wonder what could happen. But this is really important to this community here. If you look again at the amount of money that we spend on administrative costs because of all the things that I just told you, compared to every industrialized nation, but look at the amount of money we spend on long-term care. Wouldn't it be amazing if we could save money on the administrative costs by making it simpler and using that savings to then increase the long-term care benefits for all the people that need it in the United States? Be nice to be able to do that, right? And that's one of the things behind how a Medicare for all system would work. And it's no wonder we're considered to have the least efficient healthcare system in the world. Ironically, you sometimes will hear some moderate Democrats or conservative or liberal Republicans. I consider Romney now a liberal Republican, claim like we should have a healthcare system like Switzerland. Well, look at their efficiency. They're right up there with us as being the least efficient system. What's going on? So it's no wonder that if you had to do a diagnosis of what's wrong with our healthcare system, one of the biggest things is this parasite we have that is basically taking money away from the healthcare system to pad their pockets. They're making added unnecessary costs to the system, and they're really not adding much value to the overall system in general. So instead of this convoluted system on the right that I showed you before, the way we could really get around that is this single payer system where we would just have the government act as the sole insurer. So wherever you went, whatever job you had, you wouldn't have to show a different insurance card to a different doctor. You wouldn't have to be stuck in a job that you hated. You just automatically had this coverage. And many of you experienced what a single payer system could be when you went to get vaccinated, right? You didn't have to worry about pre-authorization. You didn't even have to worry about fighting with an insurance company or even telling, many times they didn't even check. You just got your vaccination or you got your test. And that's what a real single payer system could do. And that sort of demonstrates what it could do. So a single payer system really is freedom. First of all, physicians would be able to practice the way we were taught and not have a micromanager. So many times the person who's telling me I can't perform this procedure on you is not even a doctor. It's somebody who is an administrator that was never trained to take care of patients. They're following some cost containment algorithm and they're telling me I can't do it. But finally, we would be able to practice medicine the way we were taught to do it. Companies would no longer have to pay crippling healthcare costs. You know, prior to the bailout, General Motors spent more on healthcare for its retirees and its employees than it did on steel to make cars. And that could create higher wages and higher job creation. Patients would be able to go to any doctor they wanted. There would no longer be narrow networks. They would have more freedom and they wouldn't be stuck in a job they hated strictly because of healthcare benefits. Now, when Bernie announced his bill, Fox and Friends and some of our moderate Democrats went to town. They said it would cost $32 trillion and they were laughing about it. But here's the thing, on Fox and Friends' own website, when they had a poll that said, it's going to cost $32 trillion, would the benefits outweigh the risk? And they said yes, the majority of their Fox viewers. But here's the thing, the Mercatus Institute, which did the study, did find that Bernie's bill would cost $32 trillion, but they found if we did nothing and just continued the status quo, that it would actually cost $2 trillion more. So not only would Medicare for All insure everyone, increase the benefits that our current seniors have, take away copays and deductibles, increase long-term care benefits while taking care of all of our brothers and sisters who are uninsured. It would save $2 trillion over the 10 years compared to what we have right now, which is the status quo. And just to point out that a public option, which was what some moderate Democrats and others point out, it would add $700 billion over the 10 years. And all it would do was add another complexity to our already complicated healthcare system. And just to point out the difference between a Medicare for all plan and a public option is a public option would exclude our undocumented brothers and sisters. Medicare for all would not. Medicare for all is not tied to employment, whereas a public option, many of you would still continue to get your coverage through your employer. Public option would not eliminate copays and deductibles. It would not eliminate narrow networks, whereas Medicare for all would. Medicare for all, as I showed you, would save $2 trillion over 10 years, whereas the public option would add $700 billion over 10 years. You would still have administrative waste with a public option, but not with Medicare for all. And you would also get drug discounts and negotiation and prices with Medicare for all, but you would not get any of that. So you wouldn't reduce the cost of healthcare with a public option. And to point out that our healthcare system is also corporate welfare, that the top healthcare insurers right now, 60% of all their revenue comes from Medicare and Medicaid. So when you hear the private sector does things better, they're basically making a ton of money on their corporate welfare right now. And finally, I'll just say this, that when people say we don't have money to pay into this, this is a study that came out a few years ago, but I think it's actually even more now, that basically for every healthcare dollar that's spent in the state of California, 70 cents of that is already paid for by us, the taxpayers. What that means is when we give Apple and Google tax breaks to give healthcare to their employees, that's coming out of taxpayer pockets. When we pay for healthcare for our firefighters, our police officers, our teachers, all of our public union members, that's coming out of our pocket. And not to mention everything else that comes out of our pocket. So we're essentially paying for universal healthcare, we're just not getting it. When you take away all the administrative waste, all the amount of money that's spent on exorbitant CEO salaries, on marketing, when you go to a Dodgers game, you'll see Blue Cross, a big sign for Blue Cross Blue Shield or Cedars or UCLA Healthcare. They get to deduct that as, quote, community benefit, when in reality, that's advertising. But that is money that, again, is taken away from actual patient care that we wouldn't have to worry about. Because guess what? If you don't if there's only one insurer, you don't have to spend all this money for Blue Cross Blue Shield or United Healthcare running ads or doing all those things. Instead, that money could go back to keep coverage high for everybody and do away with copays and deductibles. Now, in the during the Bernie campaign in 2016, I got myself into a lot of trouble. I spoke at this rally in New York City. I referred to basically I used a very unfortunate term to refer to corporate Democrats who are beholden to the private insurance industry and the pharmaceutical industry. It was spun that that I was calling Secretary Clinton that, and I never called her that, but that's how her campaign spun it. Ironically, 2 days after this, Bill Clinton called my wife to say that he and the secretary watched my speech, and they knew I was not referring to the secretary in that way, but they were never going to go public with that. But here's what I meant by that. So this just shows you that if you look at all of the Democrats who voted against Medicare for all, they've received over $43 million in campaign donations from the private insurance industry and pharmaceutical industry over the last several years. So while the term I use may have been insensitive, the facts behind it strictly remain that we have far too many members of Congress, and particularly among the Democrats, who are beholden to the pharmaceutical industry and private insurance industry. You see it now with Kristen Sinema, Joe Manchin, and all of the moderate Dems in the House, and how they've catered to them instead of the people they desperately should be covering. And I'll just conclude by this. My mom came to the United States in 1951. She was a refugee during the Korean War. She would eventually graduate from Columbia Teachers College, and the first person to hire her was Shirley Chisholm. Now, most people don't know this about Miss Chisholm, but before Miss Chisholm ran for Congress, she was the educational director for several inner city preschools in New York City. And so she really took my mom under her wing, trained her, And then she eventually ran for Congress. And when Newark, New Jersey was starting their Head Start program in the early 60s, she told my mom, I've trained you, now you can go run the Head Start program in Newark, New Jersey. And then Miss Chisholm would go on to run for president in 1972. And she said this in 1972, that we have never seen healthcare as a right. It has been conceived as a privilege available only to those who can afford it. And this is the real reason the American healthcare system is in such a scandalous state. And I would attest that I think these words are more true today than it were, sadly, back in 1972, which is almost 50 years ago. And also, she ran under the mantra of being unbought and unbossed. And unfortunately, all of those people that I pointed out at that speech at the Bernie rally who were bought, and you can use your own word for what you think about people who were bought, really, we need more Shirley Chisholms in the world. And we need them now. So with that, I just want to point out that AB 1400, which is the California state bill, is a really strong bill. It would really galvanize long-term care here in the state of California. It would do away with the copays and deductibles that so many of you have. It would do away with the problems that you have with prescription drugs here. And you would be able to really go see the doctors that you want. But unfortunately, again, we have far too many Democrats here that are bought and beholden to the insurance industry, to the Kaisers, to the hospital association. And, you know, I think unfortunately the likelihood of AB 1400 even getting out of committee and getting a vote remains very, very slim. So whatever you all can do to put pressure on your local state assembly members and state senators and the governor, it would really be helpful to hear your voice behind that, because right now the only voices they're listening to are those that are paying their campaign donations. So with that, I just want to say thank you. I can send these slides to David and you all can have them for your own use, whichever way you'd like. But I really appreciate all the work you're doing. And thank you for continually speak up for our seniors and for those without a voice. But thank you very much.
Thank you very much, Doctor. That was a great big picture and profound presentation.